Welcome to The Pulse, brought to you by 3D Creation Systems, your #1 source for 3D printing services and technology. A team of researchers at the Rehabilitation Institute of Chicago demonstrated a type of peripheral interface called targeted muscle re-innervation, or TMR. By rewiring nerves from amputated limbs, new interfaces allow for prosthetic control with existing muscles. Former Army Staff Sergeant Glenn Lehman, injured in Iraq, recently demonstrated improved TMR technology. He was able to demonstrate simultaneous joint control of a prosthetic arm made possible by support from a DARPA program called ReNet. DARPA is interested in addressing the challenges preventing the deployment of ReNet, which stands for Reliable Neural Interface Technology, facilitating its potential to enhance the recovery of injured service members and assist them in returning to active duty. A team of doctors at Duke University Hospital helped create a bioengineered blood vessel and transplanted it into the arm of a patient with end-stage kidney disease. The procedure, the first U.S. clinical trial to test the safety and effectiveness of the bioengineered blood vessel, is a milestone in the field of tissue engineering. The new vein is an off-the-shelf human cell-based product with no biological properties that would cause organ rejection. Using technology developed at Duke and at a spin-off company it started called Humacyte, the vein is engineered by cultivating donated human cells on a tubular scaffold to form a vessel. The vessel is then cleansed of the qualities that might trigger an immune response. In preclinical tests, the veins have performed better than other synthetic and animal-based implants. Chemists at the University of Pittsburgh have demonstrated a sensor technology that could significantly simplify the diagnosis and monitoring of diabetes through breath analysis alone. Even before blood tests are administered, those with diabetes often recognize the condition's symptoms through their breath acetone, a characteristic fruity odor that increases significantly with high glucose levels. The Pitt team was interested in this biomarker as a possible diagnostic tool. The team combined titanium dioxide, an inorganic compound widely used in body care products such as makeup, with carbon nanotubes which acted as skewers to hold the particles together. This method, which the researchers playfully called titanium dioxide on a stick, effectively combined the electrical properties of the tubes with the light illuminating powers of the titanium dioxide. They then created the sensor device by using these materials as an electrical semiconductor, measuring its electrical resistance. New technology under development at The Ohio State University is paving the way for low-cost electronic devices that work in direct contact with living tissue inside the body. The first planned use of the technology is a sensor that will detect the very early stages of organ transplant rejection. One barrier to the development of implantable sensors is that most existing electronics are based on silicon, and electrolytes in the body interfere with the electrical signals in silicon circuits. In tests, silicon circuits that had been coated with the technology continued to function even after 24 hours of immersion in a solution that mimicked typical body chemistry. For more medical technology news, go to mdtmag.com. And until next time, I'm Sean Fensky, and this has been The Pulse.